And what we're gonna do is kind of go over what's called our Road to Recovery, which is a service line that we created when this unit opened probably about 3 years ago. So first what we're gonna do is kind of go over room setup and kind of show you how the room should be set up before our patients get here. We like to set up rooms before our patients get here just because it makes the process of getting them settled into their room a little bit smoother and easier. So you'll kind of see we have a couple of key things in here. Most of our patients are surgical, so typically they will go home the next day. So a lot of times we don't do like a full room setup. If you have been to another medical floor where you get toothbrush, toothpaste, all that stuff, typically we don't do that unless they ask, because the goal is to get them home in the next 1 or 2 days. So kind of see a couple of these things over here that we'll go over. Big thing is just making sure they have an incentive spirometer, which typically once the patient gets here and we get them settled, we kind of go ahead and go over that first, just so they have that expectation. She'll also show you we do have signs in all the rooms just to remind them, and then as you come on shifts, just to make sure your patient has been taught and is using their IS correctly. Also have a menu, some sandy wipes, and some tissues. Very simple. Most patients will use this. And we also have what's called our Road to Recovery folder. This is our admission and discharge folder. Whenever you set up a patient's room before they get here, each room should have it set up. If you don't know where they are, can't find any, please let one of the team leaders know your charge and we'll get you some set up, okay? The first part of this sheet is called the welcome letter. If you have patients that their family members get up to their room earlier, which a lot of times PACU does send them up early, it's good to go ahead and show this. It does have the expectations of what their role is in the recovery of their loved one. Kind of goes over the expectations whenever their patient gets here. We will ask them to step out of the room while we get them situated. Kind of goes over the goals, making sure they have their IS and that they're using it, making sure they're walking, all that good stuff. We also have some good education in here as well. So it has 3 good things in here that we add to the submission folder. Has anesthesia side effects. This is one of the projects that we've been working on, is educating our patients and family members about anesthesia side effects, just so that they know. So try to talk up ways that work. Mention anesthesia side effects. We also have recovery expectations. This is one of those questions that they get asked, did we talk to them about it? So this kind of goes over the recovery process of what to expect. So in PACU, what they kind of experienced, what our goals are at 6 East, and as well as at home, what they can expect. It also has a little guide here as a reminder if they forget how to use their incentive spirometer, just to remind them as well.
Hello everybody, my name is Elise Goins. I'm one of the CN3s here on 6 East. Kristen and I have developed this video to help you progress during your orientation and kind of get on board with what we do here. I'm going to talk about our care boards. So this is our care board. You want to make sure that you're filling this out at shift change throughout the day as the patient is completing things. You want to make sure you're marking it off as well. So pretty self-explanatory. Make sure the date, the day, the room number, fill in your nurse, doctor, your charge nurse. Your care coordinator is going to be our secretary for the day. So you want to make sure you fill that in, because that's who will be answering your call bell. Their diet. So if they were to start off on a clear diet, which they usually do after surgery, as that diet changes, you want to make sure you're updating it on the board so that the patient is aware of the care plan for the day. If they're fall risk, you want to make sure that's marked here, as well as skin. If therapy works with them and their recommendations, you want to make sure they're up there as well. And we recommend they walk 3 to 4 times a day. So as they walk throughout the day, make sure you're marking it off. That way your patient is, again, aware of our care plan. Using the incentive, making sure our pain controlled, tolerating the diet, and then if they have a catheter, when it will be removed, and when they do urinate. And then our anticipated discharge date is usually the next day for most of our surgical patients. For the time, our goal is always as early as possible, but that definitely depends on the surgeon and whenever they get here and write that discharge order. A big thing on here is pain. You want to make sure you're marking what your patient's pain goal is. And after surgery, 0 is not really a number that we're gonna get to. So we always tell them between 3 and 4, or whatever they would like, but 0 is not realistic for us. So you just want to make sure you're marking that and the last time they got pain medicine, and when they can have it again. And again, our theme is the road to recovery. So we have.
Okay, so next we're gonna go over the admission process here on 6 East. As our patients come out of PACU, a lot of times the family members will already be here waiting in the room. We do like to ask them to step out of the room while we're getting the patient in bed for a couple reasons. One, it does get kind of crowded in here with everybody trying to get situated. Secondly, patients do come out of PACU sometimes hurting, sometimes nauseous, and it's kind of hard for family members to see that. So we do ask them to step out of the room for just a couple minutes while we get them settled. Secondly, a big thing that we like to do is to make sure that they're walking from the stretcher to the bed if able. Sometimes pain's not controlled enough, sometimes they're very nauseous, but we do try to do it as much as we can for a couple reasons. The big thing is that it shows them that they can get up walking, and it kind of sets up that expectation that, hey, in a couple hours we're going to get you up walking. It's part of that road to recovery, and it kind of shows them that they can do that. So we will get them to walk from the stretcher to the bed with assistance. We do have what's called our Get Up and Go program, which is UNC Rex's program to make sure patients are getting up and walking. So it records how fast that we're getting our patients up walking after they get here from before. Our goal is to get them up walking within 2 hours, and we will show you where to chart that. But even if we're getting them walking from the stretcher to the bed, that does count as a couple of feet, so make sure we're charting it. As we get them settled to bed, we'll make sure they're comfortable, making sure their SED machines are on and hooked up. At that point, we do let the family members simply come back into the room, just so we can go over the road to recovery with them together. So we show them the folder, say, hey, this is your admission discharge folder. It kind of goes over the road to recovery, and it's a good opportunity to tell them what that is. So your road to recovery is our goals that we want to meet to get you home, hopefully tomorrow. So one is making sure you're eating or drinking okay after anesthesia. Some people do have issues with that. Making sure your pain is under control. So unfortunately after surgery, not going to be pain free, but our goal is to make it manageable for you. Kind of go over the game plan for that. Third goal is peeing. So if they don't have a Foley catheter, say, hey, our goal is to making sure you're peeing by so-and-so time, 3 or 4, 5 o'clock. Or if they have a Foley catheter, say, hey, you have a Foley catheter in right now that's peeing for you. We'll take it out tomorrow morning and make sure you pee before you go home. And then the fourth and final goal is to make sure you're getting up walking. Say with that Get Up and Go, hey, we're gonna get you up walking in the halls in a couple hours. Just an important step for recovery and getting you back home.
Now we're going to talk about your hospital stay for your patients. So on admission, you're going to make sure you get a set of vitals, and you're going to do a focused assessment. You want to make sure after your focused assessment that you are rounding every 2 hours. For the nurses, that will be on the odd hours, and for your techs, it's going to be on the even hours. Post-operatively, we do assessments Q4, so you would make sure you're doing your focused assessment based off of whatever procedure your patient had. To add to that, if they have any comorbidities, you want to make sure that you're assessing for those as well. So with your focused hourly rounding, you want to make sure that you're going in asking your patient if they have to use the potty, how their pain is doing. You want to make sure their positioning is okay, and you want to make sure that their personal belongings or possessions are within reach. So when we're talking about rounding on your patients, you want to make sure you actually use the word rounding so that they know what that is and what they should be looking for when people are rounding on them. So we're going to cue to the next morning. Your patient has completed everything on the road to recovery. They are voiding without difficulty. They're ambulating in the hallways several times a day. Their pain is managed and they're tolerating their diet. Surgical incisions are looking great, and your doctor has put in your discharge order. So once that order goes in, we would like to get those patients out within 2 hours of the discharge order. So with that being said, you're going to develop your after visit summary, and you're going to do that in Epic. And when you do that, you want to make sure that you're individualizing it to your patient. So if your patient had an appendectomy, you want to make sure you're adding in the appropriate SMART phrases. And if you're not sure what those are, your preceptor will go over that with you. So once you've added your SMART phrases and your patient's ready to go, you have your IVs out, the patient has gotten their meds from the outpatient pharmacy, and you're actually ready to get this patient out of the door, you're going to go over that after visit summary with them. And when it comes down to your signs and symptoms to monitor for once they're home, you want to make sure that you're highlighting bleeding. If they're having any bleeding, some spotting is normal, especially from like lap sites or things like that. But if they're actually having bleeding from surgical sites, they need to be contacting their surgeon's office. If they're having uncontrolled pain, whereas the pain medicine they were taking here was working, and they're getting home and having pain that's not able to be managed, you want to make sure they're calling for that as well. Uncontrolled nausea and vomiting, you want to make sure they're calling for that. And signs and symptoms of infection, you want to make sure they're aware of what those are, what that looks like, and what number to call. And just let them know that somebody is available 24/7 if they have any issues at home once discharged. We do have thank you notes that we like to give out, also with like a little mint. And you could just go back in Epic and look at who took care of that patient. It's just a special way for us to tell them thank you for choosing Rex, and that we were happy to take care of them.
If you have any questions or concerns about anything we went over during this video, please let either your preceptor and or charge or clinical leader know. We will kind of clarify. But again, thank you for listening, and welcome to 6 East.